Now we come to the deficiency of folic acid, that what happens if the folic acid is not there or deficient. The deficiency is more common in the pregnant women, infant, children, adolescent. It may also be due to poor diet or are consequences of alcoholism. ठीक है. अच्छा, अब pregnant women में क्यों? Because you know that folic acid, it is required for DNA replication and cell division. You know that the fetus is growing, is replicating, cell is dividing, DNA is replicating. The same thing in the infants, the same thing in the children when they develop, when they go to the adolescent state. In this case, if the diet is poor in folic acid, then the cell growth will be affected. Folate deficiency causes. A deficiency of folate can occur when the body needs for folate is increased, right? Dietary intake or absorption of folate is not sufficient. Body excretes or loses more folate than usual. Medications, certain medicines, they interfere with the body's ability to use folate, and therefore they increase the need for this vitamin. A defect in homocysteine methyltransferase or a deficiency of vitamin B12 may lead to the deficiency of methyl tetrahydrofolate, and you have seen all this. Folic acid deficiency, that anemia is there. Anemia can be a sign of advanced folate deficiency. Homocysteine methyltransferase, here you can see, right? Homocysteine is not converted to methionine, right? And another way, this methyl tetrahydrofolate, when combined with homocysteine, it is not converted to tetrahydrofolate and DNA synthesis is compromised. You only get stick to this, right? That is, homocysteine is not converted to methionine. एक तरफ होमोसिस्टीन का नुकसान हो रहा है, एंड मिथाइल जो फंक्शन है, बेसिकली इसका फंक्शन क्या है कि होमोसिस्टीन, it combines with 5-methyl tetrahydrofolate in the presence of MTR, methyl tetrahydrofolate homocysteine methyltransferase. Tetrahydrofolate is formed, and this tetrahydrofolate, it is required in the DNA synthesis. So it's better if you remember this part, that is, what is the role of 5-methyl tetrahydrofolate in producing the DNA. Anemia. In adults, folic acid deficiency, it causes macrocytic megaloblastic anemia, and it is characterized, that is, this type of anemia is characterized by the appearance of large size abnormal red cells, जिसे हम megaloblast कहते हैं, which are formed, and there is insufficient stores of, and these are formed when there are insufficient stores of folic acid within the body. So abnormal large red cells are formed, which are known as a megaloblast. ठीक है, when there are insufficient stores of folic acid in the body, cell division नहीं हो पा रहा. इसको हम मैक्रोसाइटिक क्लासिफिकेशन में रखते हैं. मेगालोब्लास्टिक एनीमिया is an anemia of macrocytic classification that results from the inhibition of the DNA synthesis. DNA synthesis is not there. Red cell multiplication does not take place. Production is not there when DNA synthesis is impaired. ठीक है? DNA synthesis is not taking place. Why it is not taking place? Folic acid is not there. The purine and the pyridine bases, they are not synthesized. The cell cycle cannot progress from the G2 growth state to mitosis. Mitosis cannot take place. and this leads to continuing cell growth without division. मैंने आपको क्या बताया था कि सेल बड़ा हो जाता है लेकिन उसका डिवीजन नहीं होता है, माइटोसिस नहीं होती है, and this presents as macrocytosis. मैक्रो कहते हैं हमेशा लार्ज को, right? So the red cell, it becomes a large site, megaloblast, and इसको हम कैसे classify कहते हैं? Macrocytic, यानी red cell become large but it is not divided. There is a defect in DNA synthesis, obviously. Folic acid नहीं है, purine pyrimidine bases नहीं है, DNA synthesis कैसे होगी? There is a defect in DNA synthesis in the rapidly dividing cells, as well as RNA and protein synthesis are also impaired. DNA नहीं है, RNA नहीं बनेगा, ट्रांसक्रिप्शन नहीं होगी. जेनेटिक्स आप लोग पढ़ चुके हो, इसीलिए मैं आपको बता रही हूँ कि DNA नहीं है. एक तो DNA की रेप्लिकेशन नहीं हो रही है, सेल डिवीजन नहीं हो रही. DNA नहीं है, transcription is not there, RNA is not synthesized. When RNA is not there, protein is not synthesized. Therefore, unbalanced cell proliferation and impaired cell division takes place. And this results in arrested nuclear maturation. Nucleus जो है सेल का वो mature नहीं हो पाता है. ठीक? In the bone marrow, most megaloblasts are destroyed before entering the peripheral blood, and this is known as intramedullary hemolysis. कुछ megaloblasts जो होते हैं, they escape the bone marrow. कुछ जो मेगालोब्लास्ट या मैक्रोसाइट्स जो होते हैं, they escape the bone marrow. कुछ तो destroy हो जाते हैं, some of them they escape the bone marrow and they go to the peripheral blood, और वहाँ पे they are destroyed by the reticuloendothelial system. Here you can see normal red cell, और ये देखो कितना बड़ा है. दूसरी चीज देखो, हाइपर सेगमेंटेड सेल्स है. न्यूट्रोफिल्स जो है हाइपर सेगमेंटेड है, इनके देखो कितने सारे सेगमेंट्स हैं. यहाँ पे देखो न्यूट्रोफिल्स दे आर नॉट सेगमेंटेड, हियर द न्यूट्रोफिल्स दे आर सेगमेंटेड. द डिफेक्ट इज इन द रेड सेल डीएनए सिंथेसिस. यार ये चीज रट्टा लगा लो, फोलिक एसिड नहीं होगा, डीएनए नहीं बनेगा, डीएनए रेप्लिकेशन नहीं होगी, सेल डिवीजन नहीं होगी, और उसी की वजह से जो आरबीसी है वो मैच्योर नहीं होगा. द डिफेक्ट इज इन द रेड सेल डीएनए सिंथेसिस, ऑफन ड्यू टू B12 डिफिशियंसी और फोलेट डिफिशियंसी. दोनों को रिलेटेड है. ठीक है. लॉस ऑफ माइक्रोन्यूट्रिएंट may also be a cause. Copper deficiency resulting from an excess of zinc from unusually high oral consumptions of zinc containing denture fixation creams has been found to be a cause. ये जो BDS वाले अगर इस लेक्चर को देखें तो उनको ये चीज समझें कि zinc from high oral consumption of zinc containing denture fixation creams has been found to be a cause of folate deficiency. Right? Zinc containing denture creams, they are a cause of folate deficiency. Megaloblastic anemia can also be caused by the antimetabolite cancer treatment drugs that interfere with the DNA production. मैंने आपको बताया ना कि how the cancer treatment goes on. Cancer treatment drugs, they break the DNA. They interfere with the synthesis of the DNA. For example, in place of purine bases, उनके एनालॉग्स होती हैं, थायमीन बेसिस उनके एनालॉग्स होते हैं, which are not the true purine and the pyrimidine. ठीक है. And in this way the DNA replication is blocked. When the DNA replication is blocked, the cell division is blocked. pathological state of megaloblastosis is characterized by large, अभी मैंने आपको बताया, immature dysfunctional red blood cell, megaloblast in the bone marrow. Also by hypersegmented, मैंने आपको neutrophils define किए थे, ठीक है? That is the presence of the neutrophils with 6 or more lobes, उसके segments होते हैं, or the presence of more than 3% of the neutrophils with at least 5 lobes. Segmented neutrophils होते हैं. Here you can see the segmented neutrophils are there. देख रहे हो कितने सारे neutrophils के segments बन गए. Megaloblastic anemia, decreased RBC, decreased hematocrit, increased MCV, size of the RBCs is increased, hypersegmented neutrophils, and homocysteine is increased. So don't take it easy, the megaloblastic anemia, because the homocysteine level is increased and it is not a good sign. It is leading towards the heart problems. Signs and symptoms. Loss of appetite, weight loss के अगर weakness होती है, सो टंग, खट्टी खट्टी सी जबान का जो मज़ा होता है, ये टेस्ट जो होता है ना, खट्टा खट्टा होता है, हेडेक होता है, हार्ट palpitations होती हैं, and behavior disorders, because it is required for the proper functioning of the brain. Infants and children, folate deficiency can lead to slow growth, diarrhea, oral ulcers, मुंह पे छाले हो जाते हैं मुंह के अंदर, megaloblastic anemia, neurological deterioration, abnormally small head, blindness, and cerebral ataxia. That is, the muscle contraction is not proper. Cerebral folate deficiency. Cerebral folate deficiency is when 5-methyl tetrahydrofolate are low in brain. Very good for the one correct answer. Cerebral folate deficiency is observed when level of 5-methyl tetrahydrofolate are low in brain, as measured in the cerebral spinal fluid. Although being normal in the blood में normal होगा, लेकिन कहाँ पे ये कम होगा? CSF में कम होगा. Symptoms typically appear at about 5 months of age. Without treatment, there may be poor muscle tone, lack of coordination होगी, trouble with coordination, trouble talking, and seizures. The causes of cerebral folate deficiency include mutation हो जाती है obviously, वो जीन जो के रिस्पॉन्सिबल है. जीन से मतलब देखो, मैं बार बार आप लोगों को बताती हूँ कि जीन से मतलब क्या होता है? DNA. Everything, the protein which is synthesized, if the gene is changed, then the protein will be changed. Mutation of the gene responsible for the folate metabolism and transport is changed. ठीक है? ट्रांसपोर्टर क्या होते हैं? प्रोटीन्स होते हैं, राइट? जब ये जीन चेंज हो जाती है, म्यूटेशन हो जाती है इस जीन में, जो कि इसको एब्जॉर्ब कर रही है और ट्रांसपोर्ट कर रही है. म्यूटेशन ऑफ द जीन दैट एनकोड्स द प्रोटॉन कपल्ड folate transporter result in CFD syndrome. CFD, cerebral folate deficiency syndrome, with both systemic folate deficiency, systemic that is other organs, and cerebral folate deficiency. यानी ब्लड में भी कम होता है और CSF में भी कम होता है. A serum folate level of less than 7 millimoles per liter is indicative of folate deficiency. treatment. Even when the systemic deficiency is corrected, blood में सही हो गया, blood में level सही हो गया, but cerebral deficiency remains and must be treated with the folinic acid. FIGLU test used to detect folate deficiency. In the metabolism of the amino acid histidine, there is folic acid dependent step at the point where 4-aminoglutamic acid FIGLU is formed, is converted to glutamic acid. That is, this is converted to glutamic acid. In folic acid deficient patient, this reaction cannot be carried out. It means FIGLU is not converted to glutamic acid. What will happen? FIGLU will accumulate in the blood and excreted in urine. Okay? In the metabolism of amino acid histidine, there is folic acid dependent step at the point where 4-aminoglutamic acid FIGLU is converted to glutamic acid. In folic acid deficient patients, this reaction cannot be carried out. As a result, यानी folic acid नहीं है, this is not converted into glutamic acid. As a result, FIGLU will accumulate in the blood and excreted in urine. Here you can see 4-aminoglutamate. This requires folic acid tetrahydrofolate. It requires folic acid, the form of tetrahydrofolate. Now, if this is absent, FIGLU will not be converted to glutamic acid, right? And this will accumulate in the blood and excreted in the urine.